quadrant,
Up bladder and bladder.
Did I use a 10 by 12 or 11 by 14?
Bladder and what?
So
Bladder
for the
and
gallbladder and
Gallbladder.
common bile duct, we're going to use an 11 by 14. And I'm going to center in the right upper quadrant. So this could be pre or post contrast. I'm just still going to be centering in the same place. Pre-contrast, obviously, there would be no contrast in.
That could be the scout or the say ERCP post-contrast cone down AP.
Right. So this is the cone down. Am I hitting something over there? Or is that somebody's foot? Okay. So with an 11 by 14, it's like centering for the below the diaphragm ribs unilateral. I'm halfway between the MSP and the MCP. I'm at the iliac crest and at the armpit here. See it?
See it.
Because the gallbladder is going to be right here. Usually the gallbladder is right at the bend of the rib. If you're having a hard time finding the bend of the rib, there's another landmark we can use, and that is the elbow. The gallbladder is usually at the elbow. So that's a way to kind of double check your centering. If you see the light skimming over the elbow, then you know you're at the gallbladder here. But for most people, the gallbladder is right here where the ribs bend. So this would be a scalp film or T-tube, which I'll talk to you about next week, is a contrast study we do after someone's had surgery to make sure that the common bile duct doesn't have any more stones. So they have a tube inside of them. But they inject contrast and it fills up the biliary tree here. So we're just looking at this area. Okay?
Centering point to the ear, right?
Yeah, you're right. I mean, the ear is halfway between the MSP and the MCP. The ear would work, yeah. Okay, so if we were doing the ERCP post-contrast, we would probably do him prone because the ERCPs are done in the prone position. Okay. So
You do have one that says AP though.
yeah. So the card will tell you AP or PA. Does this look right to you?
No.
What's wrong?
Other side.
Hmm? Oh,
It's the right
Remember,
side.
when you flip the patient over, you got to go to the opposite side. That's the biggest mistake you're going to make, is centering to the incorrect side. Remember what side your gallbladder's on.
So this is the post-ERCP?
This is a prone post-contrast. Well, or T-tube, anything to do with the gallbladder. We don't do gallbladders anymore, so we do either the ERCPs or T-tubes in radiography.
T-tube, ERCP.
Yeah. No GB, just T-tube and ERCP. And if you look through the lecture for next week, you'll see what the procedures we're going to be covering. Some of you may have seen this already. So again, it's halfway between the MSP and the MCP, or at the level of the elbow. Okay, go back on your back a second. All right. So we may also have an oblique post-contrast. If we're going to do an oblique in the patient's AP, we will always do an RPO oblique because the anatomy of interest is on the right side. So we just do a 45-degree oblique, centering over the right side. So again, what does this look like? Yeah, just like the rib. Well, we don't do an RPO for a rib, but for GI. Where's my shield? Okay, so this would be post-contrast oblique AP projection for ERCP or T-tube. What happens here is when the biliary tree spreads out, sometimes you don't see it all well because of the spine, so when you rotate the patient, it rotates the biliary tree off the spine so we can see it better. Okay, what if it said post-contrast prone oblique? Which oblique should we do?
LAO.
Exactly. If we're on the RPO on this side, we have to do the LPO in the opposite. LAO.
LAO. LAO.
Okay, so to do the LAO, the easiest way to do it is to have him bring his arm down by his side, turn his head that way, yeah, and then just bend and beam. And that puts him in an automatic 45 degrees.
Is the pillow going to be a thing initially?
No, well, it's a little bit low, but it's not down in the gallbladder.
Oh.
Okay, and then I have to remember to center on what side?
Side.
Right side up.
The right side.
So remember, you have to be on the correct side, the right side where the gallbladder is. So it's the side up in this case. It's side down when it's AP, it's side up when it's PA.
And on the card, you're going to say either phone or supine?
It says PA or AP. Yeah. So it'll say oblique. Does it say prone or supine? AP or PA?
It just says oblique post-contest. ERCP? That card does.
Oh, well, I think the card says prone or AP, so you have to know to do either an RPO or an LAO. Now, if you were supposed to do the AP oblique and you did the PA oblique, for this you would probably lose points because you did the wrong projection, but it's not. The X-ray would look the same. See what I'm saying? But it's better to just try to do the correct position.
They're both post.
Yeah, this is all done after the patient's had contrast. What happens in an ERCP, the patients actually turn the other way. You'll see on the slides, but they've got the scope in them, and then after they pull the scope out, they want to have one film with contrast before they send it back to the room. And the patient's been medicated, so we usually just leave them lying the way they're done instead of having them rolling over because they're all knocked out. Okay?
How many degrees rotation?
45. So everything's 45 except those IVPs are 30. Right? And then the BCUG was 30.
And the esophagram?
Well, there was a range on the esophagram of, what, 30 to 30 to 45? Yeah.
1 to 3?
Yeah. Well, my goal would be if you could understand or see what a 45-degree rotation is, I'd be really happy. It's easier to do it prone, though. So when you're doing the esophagram, it's easier to put someone 45 degrees. I think it's the AP obliques you're having trouble with. Because it's like a natural position to put them in 45 so when they lay like this.
That's for tipping also.
Well, that's not quite a tipping position, but... Okay, so you're going to have till 4:30, so you're going to have a little bit more than an hour and a half to practice your positioning, and then the last 30 minutes we're going to... I do just a very short film review today, because all the films you need to see are on the 2 PowerPoints, I think, with your positioning already. And then you're going to take a quick quiz, GU, and I'll have your test for your quiz from portables and GU for you to look at, but we'll return them all on Monday with your brain.
When we take our test for this section, is portable going to be on it?
Trauma.
Trauma and portable?
Already on.
Is that part
Well,
of it?
no, because I did the quest already on that section.
Oh,
So
okay.
this is just GIGU test.
Okay.
I know,
But then
it's
you come back to visit you on the final, of course. So don't
worry
most of
about
you
it.
did really good on the portable trauma test. The GI, on the other hand, I don't know what happened. It was like up here and down here. It's like either you studied for it or you didn't. It was like 50% and there was